Autonomous surgical robots are defined as robots that perform a surgery entirely on its own without the need for human supervision. Tasks completed by the robot can range from simple to complex, handling tools to performing full surgeries. The benefits of this technology are less invasive surgeries, as well as a lower probability of failure, due to the robot's ability to be more precise than a human surgeon. The risks of this technology are brought about by the fact that the robots are susceptible to different failure modes than humans, and in a procedure that is uncontrolled by a surgeon, failure is a possibility. This brings about a question: who is liable?
Primary users of medical robots are the surgeons and medical personnel supervising the surgery and programming the robot to perform a task. The only secondary user is the patient who is being operated on. Primary users will be impacted by this emerging technology, as they will be subject to a steep learning curve pertaining to understanding the complex robotic systems and technical components of the system. A lack of knowledge may result in errors during the operation. In addition, surgeons and medical personnel may also be impacted by this technology, as they may be considered liable if the robots were to fail during a procedure. This technology may also impact the need for doctors, resulting in reduced wages and layoffs, as these robots are able to partially or completely fill the role of a doctor during an operation. Patients may also be subject to reduced availability and increased cost of surgery, and possibly feel uncomfortable with the fact that they are being operated on by robots instead of traditional doctors.
The main ethical concern primary users face with the use of medical robotics is determining who is liable if a failure were to occur during the surgery. Is the robot responsible? Will the surgeon leading the surgery be responsible even if they do not technically control the robot? Or will the company who designed and sold the robot be liable for any failures?
This emerging technology will greatly impact how society interacts with surgeons and views surgery as a whole. Will patients trust and be comfortable with being operated on by a robot instead of a traditional surgeon? Furthermore, how will developers and surgeons ensure that the robots are not vulnerable to cyber attacks, potentially losing and exposing patient data and allowing unauthorized individuals to take control of the robot?
To ensure surgeries are safe and reliable, intensive testing will need to be performed. Given the role of animal testing in the medical and scientific community, it is likely that many animals will be harmed and subjected to discomfort as a result of this emerging technology. Are there alternatives to using animal testing to ensure device compliance? How will these clinical trials be performed?
Providing supplementary education for doctors regarding the field of autonomous robotic surgery would help lessen the technology's learning curve and any countering beliefs against the implementation of the technology. The rationale for this decision follows virtue ethics, as it will lead doctors to be more cautious in their diagnoses and surgery choice, such that all decisions made will uphold patient safety. Desirable outcomes of this action would be a better understanding of where liability is placed based on the user's actions, as well as more care taken by the surgeons, despite their inaction in the actual operating room. However, this education requires more time for the doctors to spend outside of their busy schedules, as well as requiring easily accessible, consistent, and unbiased educators. This education concept could be expanded to patients and caregivers, explaining the pros and cons, as well as possible implications of undergoing an autonomous robotic surgery. This will help mitigate any bias patients have towards these autonomous machines.
To improve accuracy of the software implemented into the system, as well as decrease the need for animals, it is recommended that clinical testing be performed on cadavers. Ethically, this parallels with Kantian beliefs, as it preserves the autonomy of the animals that would otherwise be subjected to the testing, preventing them from simply being used as means to an end. The overall desirable outcome of this course of action would be a decrease in animals harmed in the name of furthering medical technologies, as well as an increased accuracy and success rate of the robots due to improved anatomical resemblance of the test subjects. A potential undesirable outcome is that there could be a decrease in donated cadavers due to the patients disagreeing with the technology, or with how bodies may be treated during testing.
To reduce the bias against robots, as well as reduce the probability of failure, it will be important to implement common international rules and regulations for the manufacturers. These rules and regulations will outline the standards required to sell this product, such as accuracy thresholds or leakage current. This will ensure that the robots are universally validated for use, thus increasing their ability to correctly perform their tasks and help those in need. This action follows the utilitarian perspective. By conforming to standards and regulations, this maximizes the utility and quality of the product from the surgeon and patient perspectives. However, this results in longer development and release cycle. The desirable outcome of this course of action would be a higher quality of product, decreasing the probability of failure or fatality. The undesirable outcome of such regulations are increased product development times. Due to these regulations, advancements in this technology can be greatly restricted and time-consuming. This can be because of advancements which require updates to the standards. A later product release date will be imminent and more time will be needed before it can begin aiding patients.